For our machine learning project, Group 3 decided to focus on improving the health aspect of social good. After searching the Kaggle database, we found a dataset on potential indicators for heart disease. Before settling on the heart disease data, we considered various different datasets, including school datasets to predict for student grades, transactional datasets to predict for fraudulent behavior, and nature datasets to predict for tree species. The variables included if the person currently or previously had heart disease, a stroke, kidney disease, skin cancer, asthma, diabetes, or difficulty walking, as well as general observations such as BMI, gender, age, race, and finally, some health-related points such as if they smoked, drank alcohol, their physical, mental, and general health, sleep time, and their physical activity level. As our dataset was quite large and had heavily unbalanced classes, we decided to manipulate our data such that both classes have around 30,000 data points each. We aim to develop an algorithm capable of predicting whether a patient is at high risk of heart disease based on the simple health data given. This is in hopes to supply treatment early on and lessen the possible health impacts, as heart disease is extremely difficult to treat once it becomes problematic for the patient. We decided to use a decision tree to predict heart disease, splitting up our data into an 80-20 train-test split. Using the sklearn library, we built our model and obtained the following results. As we are testing for heart disease, we knew that recall would be the most important statistic, as we wanted to maximize the number of correct predictions for those who did in fact have heart disease. A recall of 0.73 indicates positive results. However, there would be many misdiagnosed patients if this model were to be used. Although decision trees are easy to implement and interpret, they tend to overfit the data. Given our data is related to health, there are so many factors which have an influence on heart disease. It would be extremely hard to predict a patient's condition whilst maintaining high accuracy, yet not being overly biased to the training data. It would not be unwise to search for better alternative methods with a much higher performance rating. Overall, Group 3 had a lot of fun working together to find an algorithm that would do the task at hand. For some of us, it was an eye-opening introduction to data science, as not all of us had experience working with large datasets. It was especially enjoyable researching and understanding the multitude of machine learning algorithms performed by data scientists all over the world.